Marquita. I'm the nurse practitioner student that's going to be taking care of you today.
Nice to meet you. I'm Maddie J.
Maddie J. And what is your name, your date of birth, Maddie J?
2/14/1999.
Okay, excellent. Have the right person.
Yes.
All right. So what brings you in today?
Just here for a physical.
Okay. So you usually come every once a year?
Yeah, I do.
Okay. So it's our first time meeting you, so I'm going to ask you a couple questions, kind of get to know you a little bit. Tell me about yourself.
30. I'm single. I do live alone. And I'm a principal at
Oh.
elementary school.
Wow, that's awesome. So what's your education like?
I have a PhD in education.
Wow.
I taught for a while,
Okay.
and then I like the other aspect of it as well. So
Wow, that's awesome. Good work. I don't know how you
thank you.
teachers. I'll give my hats off to you guys.
Thank you.
So do you smoke?
No, I don't smoke. I occasionally drink, like a social drinker.
Okay, so
Every
you
now and
one drink a week, what average?
Probably one drink a month, and then I'm a
Okay.
sipper. That one drink lasts me all night.
Yeah, that's good. It's cheap that way. So do you have a pretty decent diet? How would you describe your diet?
It's pretty decent. I'm trying to eat more grilled fish and
Okay.
chicken.
Okay.
Like more seafood and stay away from fried.
Mm-hmm.
You know, a little bit more vegetables.
Okay. So you typically cook your own meals, or do you eat out a lot? Fast food?
I eat out, but it's not really fast food. I try to do more grilled stuff even when I go out.
Okay. Yeah, but there's definitely good options nowadays. Where are you from?
I'm from Florida.
Florida. Okay. That's wow. Okay, really good food in Florida.
It is.
Yeah. Nice seafood. Okay. So how would you describe your usual activity? Are you pretty active? I mean, you have as a principal, you're pretty sedentary.
Yeah, as far as my job, but I do like to play like softball and be outside.
Okay.
I can't say I exercise
Right.
every day,
Okay.
but I do get some physical activity.
Okay, yeah, that's really good. I mean, as we age, it's definitely more important to stay active and keep our bodies
That's
intact.
true.
So how about your childhood? Let's go back a little bit.
Okay.
Have you had any childhood illnesses?
No, I haven't even had chicken pox.
What? No,
My
chicken
friends
pox?
have had it.
Okay.
I have not had chicken
Wow.
pox. But my titer was positive though.
Huh.
So I guess maybe I was exposed.
Maybe.
But I didn't have an outbreak like the sores and stuff.
Okay. So that's interesting. Okay. Any measles?
No.
Scarlet fever? Rheumatic fever?
No.
Okay. How about in your adult life? Any adult illnesses?
Guess I've had hypothyroidism. I've had that.
Hypothyroidism.
Yeah.
Okay. When were you diagnosed with that?
When I was like 25, so 5 years ago.
Okay. Hypothyroidism. And are you taking any meds for that?
Yes, I'm taking Synthroid.
Synthroid. Okay. Do you know what's your dosing for that?
It's 100 mics.
100 meds once a day.
Mm-hmm.
Okay. Do you want to take it at night?
In the morning.
In the morning. Okay. Any heart disease? Any diabetes?
Diabetes does run in my family, but I don't have any.
Okay, diabetes runs in the family. Okay, any breathing problems, asthma?
No breathing problem.
Okay. Any kidney issues?
No kidney issues.
Okay. Have you had any surgeries in the past?
Yes, I had a myomectomy done. That was in 2015,
Okay.
and I had a brain cyst actually drained in 2019
Wow.
on my right side, so I have a reservoir here.
Reservoir there. Okay. Wow. Does that bother you at all? Or you?
No, actually, I felt 100% better after the surgery.
Wow, that's awesome. Surgery is just an amazing
It
thing.
really is.
Yeah.
But to think that somebody's drilling a hole in your head,
I know.
That's
Had
so
to have been scary. I'm sorry you had to go through that.
me too, but I'm better.
Yeah, that's awesome. So that's the only surgery you've had. Have you had any kids? C-section?
No,
Okay.
I
Do you want kids?
I do want kids.
Okay.
But, the history of fibroids sometimes it makes it a little harder.
Okay.
So I do have what I call my C-section scar
Okay.
from my myomectomy, so it's a vertical.
Okay. Vertical scar. Okay, we'll look at that when we look at your skin.
Okay.
Okay. Tell me about your family health history.
Overall, kind of from the south, so I told you about the diabetes, no hypertension. My mom did have breast cancer.
Okay.
She has multiple sclerosis, and my dad had colon cancer, which spread to his liver.
Okay.
Yeah, he ended up passing away.
Oh, I'm sorry to hear that. Your mom is still living?
Yes, she is.
Okay. And how about your mom's parents?
Just old older people.
And they're still living?
They're in their 80s. My
Oh, wow.
grandmother will be 85 in July.
Oh, wow, good for her, that's awesome. And then your dad's parents?
They both have passed away. And
Okay.
they passed away in their 80s.
Okay, wow, alright, so,
So no longevity.
yeah, you'll have a long life to live,
Yeah.
long life ahead of you. Alright, so do you have any siblings?
Yes, I have 2 sisters.
Okay, do they have any health conditions?
Yes, my middle sister has hypertension.
Hypertension, your sister, okay. Let's see, are you sexually active?
No.
No, okay. Would you identify a sexual orientation, you, heterosexual, bisexual, homosexual?
Heterosexual.
Sexual, okay. When you are sexually active, do you use contraception?
Yes.
Okay, condoms, birth control, both those ones, okay. Any history of any, sexually transmitted diseases? No, very good. When was your last, menstrual period?
Last week.
Last week. Okay. Do you usually, have normal periods, normal bleeding?
Now I do, but
Okay.
before my surgery, they were very, very heavy.
Very heavy, not a cramping,
And lots of bleeding.
that's okay, alright, well, good thing you have that.
Yes,
So that's gonna be terrible,
it
right?
is.
Being a woman is so
It
hard.
is. I had to wear the pins.
Oh my
On
goodness.
top of things. And
Wow.
Yes, it was bad.
Oh, that's horrible. So you see your GYN regularly, I understand?
Yes, I do.
Yeah, okay. You go and get your pap smear, how often do you get that done?
Well, it's changed now because I've had normal ones,
Okay.
so she let me skip a year.
Okay, so you do it every 2 years? Okay.
Or 18 months.
Every 18 months, alright, every 18 months. So when's your last pap smear?
It was last year.
Last year, okay, so you're coming up soon to be due for another one, okay? Have you had a mammogram done? Okay. You're pretty young, okay, your mom's family history of
Right.
breast cancer,
So
okay.
because of that, they did find that I have a non-cancerous lump in my left breast,
Okay,
and there's a marker inside.
okay,
So I was told it would never be cancerous, that lump, so.
okay, alright, that's good that you're getting a head start on getting these things, screened. And you mentioned your dad's, colon cancer, so have you had a colonoscopy yet?
I have,
You
and I didn't have any polyps.
Okay, that's awesome, it's good to hear. Can you tell me about your immunization history?
I've had the normal childhood stuff. I had a DTaP done
Okay.
about 5 years ago.
Okay.
I've had COVID vaccine done.
Okay.
And the booster.
Booster shot too. Have you had COVID?
No,
No, yeah, that's,
fortunately, no.
yeah, me
Yeah.
either. Somehow, knock on
Yeah.
wood, haven't had it yet. I've been working in the school district now.
Mhm.
Kids are coming back sick.
Fortunate,
Wow,
yes.
so it's good that you got that booster, to
Yes.
keep your body protected and all that. Or you do wear masks at work?
I do.
You do.
And I've also had the flu vaccine.
Oh, okay, so that's it. Awesome. All right, so you tell me about your allergies. Do you have any allergies?
Yes, seasonal.
Seasonal allergies. Okay. Do you take any meds for that?
Yes, I take Singular at night.
Okay.
I also have like nose sprays.
Okay.
I take some over-the-counter stuff. I also have a latex sensitivity. I don't know if you know.
Okay, that's awesome. My latex, my gloves are not latex, so that's awesome. I use
Yes.
natural gloves for my
Good.
exams, so that's good. All right, awesome. So no allergies to any foods.
No.
Any medications.
No, because actually I had an allergy test done last year,
Oh, okay.
and they found that I was allergic.
Oh, okay, good. Now, a lot of people are like allergic to like penicillin or something like that. Have you
I
prescribed
was
anything?
concerned, but because I have eczema scars, and they told me I wasn't
Okay.
allergic to anything. So.
Okay, all right, awesome, okay, so let's go a little bit into your medication regimen. I know you said you were on your, thyroid medication, you take that once a day. Anything else that you're on? Your Singular?
And I do take the Camilla because of my history of fibroids.
Okay, that's
So,
your
yeah, I take that at night.
At night, once a day, oral pill or is it
Yes.
liquid?
It's oral.
Okay, alright, let's see, do you use any type of herbal supplements? Any like, vitamin C, vitamin D,
Well,
vitamins?
I've done like, echinacea
Okay.
with vitamin C.
Okay.
I've done that.
Alright, good. Definitely. It's flu season now, so you got extra protection. Alright, so have you had any recent like weight gain or weight loss unintentionally?
No.
No, okay. So I'm just gonna go through, and do kind of an overview of what I'm seeing so far,
Okay.
and then we'll go from there. So generally being able to maintain your weight over the years, that's good. Skin, you noted that you have eczema, so where is your eczema located
Well, there's some on my leg, but you can see like some old scars here
Okay.
and here.
Okay.
Just a couple of places.
Okay.
Some of them are starting to heal up, but
Yeah, I see
they're
that.
actually starting to scar me the older I get.
Yeah, so you got some hyperpigmentation there.
Mm-hmm.
Do you use any type of special topical?
Eucrisa.
Eucrisa,
Yeah,
okay.
that's what the allergist gave me.
Okay. And do you use anything over the counter from like Walgreens? Or?
I just try to use like Cetaphil, like
Okay.
glycerin,
Okay.
stuff like that.
Okay.
I try to bathe in unscented soaps
Okay.
and use unscented fabric softener and detergent.
I gotcha. Okay. So I mean, you had your brain surgery before, but do you have any other history of head injury? No concussions or anything? How's your vision?
It's fine. I actually went to see my eye doctor 2 months ago.
Okay. All right. So do you wear glasses?
Glasses and contacts.
Okay. Okay. So you have you're nearsighted. So you use
Yes.
glasses for seeing far away or for reading?
Seeing far away.
Okay. All right. So let's see. Do you have any history of like ringing of the ears? We call it tinnitus. Do you have any experience with that?
No, I've had a couple of ear infections.
Okay.
Just because my ears itch and I pick at them.
Oh, okay. Yes. Okay. I did notice that you wear braces. How long have you had braces?
For about 6 months.
6 months. Okay. And how's that been going for you?
It's fine. It's different.
Yeah.
It's fine.
Yeah. Definitely. And I can imagine having it as an adult. I had,
Mm-hmm.
you know, as a child, and it was annoying then. So
Yeah.
I can imagine. I mean, it's probably okay to have it as an adult as well.
Well, it actually worked out because of COVID. We wore masks.
Oh, right.
So I kind of timed it.
Yes, so you're able to just hide
So a
behind.
lot of people don't know
Don't
I
even
have
know it.
braces.
Wow, that's actually a really good idea.
Mhm.
I never think of that.
Exactly.
Okay, so do you notice any, in other words, like tooth pain that comes along with braces, but any other tooth pain,
Except for when they tighten them sometimes,
Okay.
but that's it.
yeah, any loose teeth, any gum pain,
No,
any like inflammation, bleeding?
no.
Alright, so going over to your neck, do you have any lumps or anything? I see like some moles, or
Yeah.
anything, those are,
It's like the older I get, because my grandmother had a lot, they're
Okay.
starting to pop out more on me.
gotcha, okay. There's no like draining or anything,
No.
and then, no pain in your neck?
No.
Okay. Respiratory wise, do you experience any wheezing,
Mm-mm.
any shortness of breath?
No.
You ever had a chest x-ray done before?
No.
No, okay. I mean, you typically won't really
Yeah.
have it unless maybe like you have a TB, abnormal TB or
Right.
issues that way, so, okay. So CV wise, do you ever experience any chest pain?
No, it's gas.
that will do it. Any palpitations?
No.
Okay, do you drink a lot of caffeine?
Not a lot.
Okay.
Yeah.
That's good. By the times I've seen people come in that have palpitations, it's normally from like excessive caffeine use. I know working a job like you do, you have to caffeinate yourself and keep
Right.
your energy up, so
Right.
that's good, all right. Do you have any blood pressure issues? Have you gotten your blood pressure checked?
Yes,
recently?
I've gotten it checked, but no issues.
Okay, yeah, I saw on the chart actually, it was 119/69, so that's perfect,
And so
awesome.
my kids run through the hall, and then it's
And then
180
it
over
goes up. Oh my
200.
God, I can only imagine. Oh my goodness. So, have you ever had a EKG done?
No.
Okay. Yeah, you typically wouldn't if unless there was an issue with
Right.
abnormal heartbeats or something like that. How about GI? How would you describe your appetite?
It's good.
Your pretty good appetite. Okay, you're able to like make 3 meals a day or eat 3 meals a day, snacks.
2.5.
So 2.5. Okay.
Yeah.
All right. So, but your diet overall pretty
Pretty
healthy.
Yeah.
Something earlier that you try to eat healthy and grow stuff.
Right.
Do you have regular bowel movements?
I do.
Okay. Also, how often would you say you go?
Once or twice a day.
Okay. Wow, that's
Yeah.
impressive. All right. So urinary. Do you have any painful urination?
No.
Any burning?
No.
Any flank pain?
No.
Frequent urination?
Mm-mm.
Okay. All right. So, do you have any history of any pelvic infections?
No.
Okay. So, how about peripheral vascular? Any leg pain or numbness at all?
Oh, no.
Okay. Musculoskeletal, any lower back pain you experience like at the end of the day, get on your feet?
Yeah, sometimes with that.
Yeah.
For the most part, no.
Okay, so nothing
Yeah.
that's like consistent.
Right.
Okay. Any joint pain or stiffness?
No.
Okay, nothing there. Okay. Going through your psychiatric history. Do you have any history of depression?
No, just case mild blues, but no depression.
Okay. Any history of depression in your family?
No.
No. Okay. Do you ever feel like you ever have suicidal thoughts? You think of harming yourself or others?
No.
No.
But that has happened in my family before.
Okay.
History of suicide.
Okay. So who? Mom's side, dad's side.
Mom's side.
Okay. All right. How do you typically handle stress?
Listen to music.
Okay.
Just try to unwind.
Okay.
Quiet space.
Okay.
Talk to family members.
Okay. So you have a pretty good support system, you would say. Okay, that's great. Awesome. So I know you had your brain surgery a couple years ago. Do you have headaches now? Do you have any more headaches? So that has been resolved?
Yes.
Okay. Do you have any episodes of like memory loss?
I would call it memory loss, maybe forgetfulness.
Okay.
Forget where you put your keys.
Yeah, I mean,
You know,
it happens
there
to
you
all of us.
go.
We'll forget what
There you go,
sometimes,
exactly.
yeah. That's not concerning there. All right, going into your hematologic system, do you have any bleeding issues?
No, not anymore since my fibroids were.
Okay, awesome. So that's six bleeding issues. Do you have any history of anemia that you're aware of?
Yeah, with my fibroids, but not anymore.
Okay, so that's been taken care of.
Mm-hmm.
All right, so endocrine, do you have any blood sugar issues?
No.
No diabetes. You said a history of family history of diabetes. but
Right.
you have not. Okay. Any frequent urination or excessive thirst?
No.
Okay. So no polydipsia or polyuria. All right. That's awesome there. So let's look into your chart a little bit further. See if I missed anything about anything that you put on your questionnaire here. All right. I don't think that's okay. All right. So I want to just want to do a thorough assessment from head to toe. I have a bunch of different things here I'm going to use to help me out with my assessment. So starting with like your neuro and kind of your thought process, can you spell the word baby backwards?
It'll be Y-B-A-B.
Okay. So my patient here, you are awake, Maddie, and you're alert. You understand my questions and you respond appropriately, so that's good. What is your name? You already told me your name.
Maggie J.
Okay, and then where are you right now?
I'm in your office.
Okay. And what is the year that we're in?
It is 2022.
Wow, time flies.
It does.
Goodness gracious. So who's the president?
Biden.
Okay. So the patient is you're oriented to person, place, and time. You're sitting quietly. Your posture is upright. You're relaxed. All the movements are spontaneous and voluntary. All your limbs are mobile, from what I can tell. Your demeanor is pleasant. Facial expressions are calm and relaxed. You're approachable and open. Your speech is clear. I can see that. And you have no aphasia. Speech is fluent. You're able to comprehend language. So that is awesome. I do have a question. So what does apple and orange have in common?
They're both fruits.
Well, fruit's awesome. So you're able to identify relationships between things and people. That is amazing as well. So moving on from that, I'm going to kind of assess your skin. So from that, I'm starting to say your insight is good to you're able to establish relationships and your insight is good. So looking at your skin, I'm going to first just do an overall look over your skin. And I noticed like the eczema spots earlier. But overall, everything looks to be pretty intact. Your skin color is brown. So we have your hair is evenly distributed throughout the scalp. No lesions noted. So we also have that your skin, your texture is warm. Skin turgor is elastic. There's no tinting when I pinch your skin. There's no skin lesions noted, as I stated before. If there weren't any, I would note the size, location, the pattern, and texture, because we would be concerned for like skin cancer and melanoma. So now I'm going to be kind of looking at your head, ears, eyes, and throat.
Okay.
So the first thing I'm going to kind of assess your cranial nerves. There's 12 of them, so I'm going to do a series of exams there. So first I want to test your sense of smell. So I'm going to close your eyes. Can't peek. So you're going to let me know what you smell. I'll take a deep breath. Orange, yes. Now I have one more. I'm going to take a deep breath in. Close your eyes. What do you smell there? Lavender, yes. So my favorite scent. I love to keep the office nice and in Zen. It's very
Don't be
calming.
asleep over here.
Yeah. Wake up.
Okay.
All right. So we're going to check your vision. So there is a chart over there. I want you. Are you able to see it from where you're sitting? Okay. Can you tell? Can you which line can you see on your chart most clearly?
The eighth one.
Okay. Maybe that.
AHJEFCT.
Okay. Close your left eye. Cover your left eye.
Okay.
And then read. What line can you see?
The eighth.
Okay.
And that's AHJEFCT.
Okay. And then cover your other eye.
Okay.
And then what line can you see most clearly now?
The eighth.
The eighth line again. Okay. Go ahead and read it for me.
AHJEFCT.
Perfect. All right. So your vision is 2015 in both eyes. That's amazing. But you're wearing your contacts now. Okay. All right. So now I'm going to kind of dig a little deeper into your vision nerve. What I'm going to do is check your peripheral vision.
Okay.
So I'm going to look straight ahead.
Okay.
Gaze your eyes that way. You're going to let me know when you can see my hands. Okay. I'm going to come on your left side.
Yeah.
Okay, perfect. Your peripheral vision is intact. Got pen lights from before. Okay, so now I'm going to check your 6 cardinal fields of gaze. So I'm going to just going to follow my pen wherever it goes. Okay, I'm going to diagonal. Okay, great. So no nystagmus noted. Your eye extremity seems to be intact. Okay, so then I'm going to go on and look at your pupils and check on my pen light. My pen light is going to be on. And I'm going to have you just look straight ahead. I'm going to shine the light. This way. Okay, and then look at this one. Okay, and then I'm going to have you look at my pen light. Alright. Awesome. So that is great. Pupils are equal, round, directed to light, and a combination. Okay, so now I'm going to kind of look at your facial and your jaw. So clench your teeth for me. And I'm going to feel your masseter muscle and your temporal muscle. Okay, that's great. Those are within normal limits. And can you open your mouth, your chin? Okay, your jaw strength is intact. So now I'm going to have you close your eyes nice and tight. Open them. You smile, frown, puff out your cheeks. Okay, perfect. So your facial muscles are intact. I'm going to do a little like whisper test. So I'm going to have you cover your left ear. I'm going to whisper in your right ear. What did you hear me say?
Couple punches.
And then on the other side.
California.
Perfect. Your hearing is intact, from what I can tell. That's awesome. Okay, so now I'm going to take a look into your mouth. Look at your tonsils. I'm going to open up and say, ah. Okay, and I'm going to just have a little bit of tonsils go deeper. Press that, and keep your tongue up and down. Okay, and good there. Okay, and your gag reflex is also present. I don't want to gag you again, but I did see that. She's able to talk without any hoarseness as well. So that is another one of our cranial nerves that we will be assessing. And also with your nerve number 12, your hypoglossal nerve, I'm going to have you stick out your tongue and move it from left to right. Okay, so your cranial nerve number 12 is also intact. Okay, so I'm going to now inspect and palpate your head, scalp, and sinus area. Okay, so I'm going to inspect your head, look at your sinuses, your scalp, no lesions, everything is within normal limits. I'm going to palpate your temporal sinus, maxillary sinus. Are you tenderness noted there?
No.
Okay, no swelling. That's great, great. Write down my notes here. You say you did have a history of sinuses, but yeah, there's not anything here. All right. So all your cranial nerves are intact. Like I told you, they're all 1 through 12. They're intact. Everything looks good within your sinus area, your head and scalp, all within normal limits. The TMJ is also within normal limits. So I'm going to take my next tool here. I have my ophthalmoscope. I'm going to inspect inside of your eye, look at your retina. So I'm going to just, look normally. I'm going to look in here with that. Don't turn the lights down so I can see more accurately. I'm going to look into your right eye. Look up for me. Down. And up for you. Look to the left. Okay. So looking into your retina, the red reflex is present. The retina is clear. The optic disc is orange. The outline is sharp. The arteries and the veins surrounding the retina are all normal. So I'm going to use my otoscope now. I'm going to look into your ears. Okay, check to make sure. I know you have a history of ear infection, you said? Yeah, so I'll kind of look into there and see. I'm going to pull your tragus back, near. Okay, I'm going to look into your right. The ears are clear of wax. It's not a lot of wax built up in there, so that's good. You must have really good ear hygiene.
I try.
Yeah, I know it's tricky, especially when you put things in all the time.
Yes.
You have your AirPods and your headphones. But your tympanic membrane is intact. The cone of light is at 5 o'clock on the right, and I saw it's 7 o'clock on the left, so that is perfect. Your tympanic membranes are not bulging, so you are not having an active ear infection, so that's good. So next I'm going to perform the Weber test. I'm going to use a tuning fork I have. So it's going to, I'm going to vibrate it. I'm going to kind of like test your sound conduction. So first I'm going to I'm going to make it vibrate, and then I'm going to place it on your head. You'll hear noise.
Okay.
Do you hear it louder on the left or right, or equally?
It's equal.
Okay. So now I'm going to do what they call a Rene test. It's going to test your conduction to see which one is greater, your bone or in the air. I'm going to make it vibrate again. I'm going to put it on your mastoid bone. Let me know when you stop hearing it. Okay. And I'm going to do it again and do it out in the ear. Okay. So your air conduction is greater than your bone conduction. That is normal. Awesome. Make a note of that. So make sure you're not having any issues with your ears and your history of ear infection. Okay, so I'm going to, I know I palpated the sinuses before. I'm going to just percuss the sinuses as well as to just see how those resonate. So I'm going to percuss your frontal. Your maxillary. Okay, that's good. There's no tenderness was noted there. So next I'm going to use my pen light again and transluminate the sinuses. I'm going to open your mouth for me. I'm going to check your sinuses from the bottom. Right, awesome. Let's see, the transformation is normal. There's a bright light, which means you have normal air-filled sinuses. That's good. You must not be having any issues. Your medicine must be working. That's good. Awesome. So I'm going to inspect your nose. Look inside of there. Okay, your nose is clear. There's no drainage. It's patent. Septum is midline. Okay, I'm going to have you open your mouth again. Look at your cavities. Not your cavities. Look at your oral cavity.
And like, do I have it?
I'm like, no, okay. I am not a dentist. Okay. But I was able to see your oral cavity is moist and pink. So now I'm going to look at your neck. I'm going to palpate your trachea here. Okay. So trachea is midline. There's no deviation. And then also I'm going to have you swallow. Okay. Thyroid is normal. All right, so now I'm going to go on and palpate your lymph nodes. Actually, there are 10 of them. These are kind of like the vessels that drain your fluid through your body. So if you're feeling have an infection or anything, inflammation, these things typically swell up. I'm going to go through and check out those. So we have your preauricular. Okay, that's good. And your posterior auricular. And then we have your occipital and your tonsillar, your submandibular, your submental, your superficial cervical, your posterior cervical, your deep cervical chain, and then your supraclavicular. All of them flows are normal and all within normal limits. They're not tender. So now we're going to go into the respiratory system. Okay, I'm going to inspect your chest before I listen. Please take a deep breath in and out. Okay, awesome. Your chest wall movement is symmetrical. And so I'm gonna let's take a listen to your breath sounds, listening for normal breath sounds, abnormal breath sounds, and transmitted breath sounds. Okay, I'm gonna take my stethoscope using the diaphragm of that, and then you just can breathe normally. Just listen. Okay, I'm gonna do this back here. Say the word 99.
99, 99, 99, 99.
So your breath sounds are clear and equal. There's no bronchi, there's no crackles. So that is awesome there. So I'm going to next palpate your chest and check for any tender areas here. Any pain, any tenderness? Okay, so no tenderness noted in the chest. The chest is not tender and the chest expands equally and symmetrically. And finally, I'm going to actually percuss the lungs, and then I'll listen to the resonance by doing that. So. Great. There's good resonance throughout the lung sounds, and that is a good sign. So we're going to go to the cardiovascular system. I'm going to just look over your heart and start off by listening to your carotid pulse, which is the one in your neck.
Okay.
So I'm going to get my stethoscope and listen to that first before I palpate it. Okay, awesome. There's no brewing noted there. I'm also going to palpate. Okay, and carotid pulse is normal. That's awesome. I'm also going to take a look, and there's no jugular vein distension, no JVD noted. So next, I'm actually going to have you lie down. I'm going to lean back that way. I'm going to actually try to palpate the point of maximal impulse. That's going to be in your fifth intercostal space, mid-clavicular line. Okay. So I'm going to start from your cervical here, and count down here, second intercostal space, third, fourth, and fifth there. I'm going to go here. So she's on her left. You're on your left side. That's where the aorta is most superficial. We're going to feel the pulse of maximal impulse, and that is normal. I'm going to take a listen to that as well. All within normal limits. Okay, so that I had her lay on her left side, to put the apex with the most superficial part of the chest wall. I was able to palpate her PMI diameter, which was 2.5 centimeters. It wasn't visible. So now I'm going to actually take a listen. You can sit upright this time. I want to listen to your 5 auscultation sites. I'm going to go through those systems, take a listen to that, starting with your aortic, which is in your right of your sternal border and second intercostal space. Let's make sure I document this properly. That's your aortic. I'll use the bell and the diaphragm to listen. Your pulmonic on the other side. Okay, and then we have your Erb's point, and then tricuspid valve, and mitral. And the same thing, using the other side of my stethoscope, the bell and the diaphragm to listen to these sounds. The aortic, and the pulmonic, Erb's point, tricuspid, and mitral. All right, that's great. Okay. So, I was able also to hear your heart rhythm, which is normal. I hear S2 and S1 and S2 that are auscultated, no extra heart sounds, no dystolic or systolic murmurs were auscultated. And so now I'm going to palpate all of your peripheral pulses. So I'll start with your radial. Your radial pulse is +2. Do your brachial. Okay. Do your popliteal. Posterior tibia. Okay. All the pulses are +3 bilaterally, equal throughout, both in upper and lower extremities. And then I'm going to actually check your cap refill on your hands. Okay, refill is less than 3 seconds, so your perfusion is very, very good. So now we're going to move on to looking at your abdominal. So I want to have you lay back on the exam table for me. And I'm going to inspect first before I listen. Inspect and listen before I palpate the stomach. I'm looking at your stomach. Your abdomen is symmetrical. The contour is flat. It's not distended. The color is consistent with ethnicity. There's no scars or bruising. I do see the scar from your procedure that you told me about earlier. That's healing nicely. But no other discoloration or ecchymosis. No pulsations noted. I'm actually going to auscultate now your bowel sounds and then your aorta, your iliac, and your femoral arteries. I'll start with your bowel sounds in all 4 quadrants. Okay, bowel sounds are active, they're not hypoactive or hypoactive. They are consistent throughout. There is now I'm going to listen to your aorta and document that. I'm going to listen to your aorta now, which is in your stomach region. Listen for bruits, I don't hear any. And go look at your left iliac, and your right iliac, your left femoral, and your right femoral. Okay, there's no bruits were auscultated, so that is amazing. So now I want to percuss the stomach. Okay, labeled to percuss over the stomach, over the liver's edge, and the spleen. So now I'm going to palpate. I'm going to use both light pressure and deep pressure over the entire stomach. So applying light pressure here. Do you feel any tenderness, any pain?
No.
Okay, great. So now I'm going to do some deep palpation. I can feel the liver's edge here. It feels like it's about 7 centimeters. Okay. No, I don't feel any abdominal masses. There is no tenderness. I felt the liver's edge there. And so going into GU, there's no bladder distension. I'm going to try to palpate the kidneys, and in normal theory, you shouldn't be able to feel the kidneys unless there's some kind of infection going on.
Okay.
So since you're laying on your back, I'm going to have to say where you are. I'm going to feel for the kidneys there. Feel for the kidneys on that side. Okay, I'm not able to feel the kidney, which is normal. You should not usually feel the kidneys unless there was some kind of infection happening. When I sit up, I'm going to check for CVA tenderness. I'm going to place my hand back here. Any pain?
No.
Okay, so CVA tenderness is not noted. So that is awesome. All right, so moving on to your musculoskeletal system. I'm looking at your posture. Your posture is good. You're sitting upright. Your spine seems to be straight. There's no scoliosis noted. I'm going to palpate your wrist here and do what you call the snuff box. There's no tenderness noted.
No.
Okay, good. I'm going to have you hold your hands out and look at your joints now. Look at your MCP joints and your DIP joints. I don't feel any nodules or anything. Is there any tenderness or pain?
Mm-hmm.
Okay, so that's within normal limits. I'll test your range of motion of your hands now. You make 2 fists with your hands. Okay, open your hands up. Spread your fingers and close. Okay, awesome. So it's good there. I'm actually going to do the wiggle test. You're going to close your eyes and hold your hands out. I want to wiggle one of your fingers and tell me which finger I'm wiggling.
This one. This one.
Okay, pass the wiggle test. That's good. So now I'm going to palpate your knee and your ankle joints. Good. Any tenderness there?
Mm-hmm.
Okay, so there's no nodules, didn't find anything there. So now your range of motion of your neck, I'm going to have you look up and put your head down, look to the left and to the right. Okay, range of motion of your neck is normal. Can you stand up for me?
Mm-hmm.
I would like you to bend over and touch your toes if you can. Awesome. Stretch your arms out front, out to the side, up in the air. Great. Okay. So then, you can have a seat again. You got a seat. I'm going to have you stretch out your legs out straight there. Perfect. I want to have you push up on my legs. Okay. Range of motion of the hips are intact. Legs are also intact. And they're looking at your legs with no edema noted. If there were, I would scale it from +1 to +3. There is no edema noted there. That's normal. So next I'm going to have you flex, you're gonna flex your feet. And this other one. And then point and push against my resistance. The other. Perfect. Range of motion is normal. Strength is normal on your feet. So now, on to that, we went through your upper extremity. I want to have you actually grab my finger, squeeze as hard as you can. Okay, your hand strength is both a +5 on both sides. I'm going to actually test out your upper arm strength. You can sit where you are. I'm going to have you make a bicep curl, and then you're going to push towards me. I'm going to push towards you. Resist me. Okay, and then pull towards yourself. Awesome. Okay, strength is +5 bilaterally in your upper extremities. I already tested your lower extremity strength for your feet and your legs. They were all within normal limits, +5. So now we're going to go through to our final system, which will be your neurological system. I'm going to assess your rapid movement. So I'm going to have you put your hands on your knees and flap up and down. Okay, beautiful. And then hold your arms out straight. Touch your nose. Perfect. Faster. Go faster. Perfect. Beautiful. All right. So now I'm going to have you take your right foot and go from here, knee to your shin, and then take it the other way. Perfect. And I want to test your gait. Can you get up and walk across the room for me normally? Okay, gait is steady. When you walk back, I want you to, can you walk heel to toe? All right, awesome, within normal limits. Now, when you're going that way, can you walk on your toes? Perfect. And then coming back, can you walk on your heels? Great, awesome. Can you bend down and do a squat for me? Beautiful. All right, range of motion is good there. So now I'm going to, while you're standing, you're in a good spot for me to test for pronator drift. So what I'm going to do is have you stand up straight. You're going to have your arms out and your palms facing down. Close your eyes. I'm testing to see if you are drifting. There's no pronation or drifting noted, so that is good. Okay, and then since you are up there, we're also going to do the Romberg's test. Okay. So also very similar. You're going to close your eyes. This time your arms are going to be at your side, feet together. Close your eyes. I'm testing for if you're swaying, if you're rocking. It's going to look at your balance, your equilibrium. So your Romberg's test is negative, so that's awesome. Okay, so then I'm going to have you have a seat again. I'm just going to go through to your reflexes. I'm going to use my reflex hammer here. I'm going to check your biceps first. Actually, no, I'm sorry, your radial reflex. That's normal. Okay, and then your biceps. Normal, and your triceps. Okay, and then we're going to do your knees, your leg reflexes. Okay, your Achilles. Okay, perfect. So your reflexes are within normal limits, +2 in good form. So a couple more things, and we're going to end our exam here. I'm just going to check your sensation and see if you're able to differentiate between like a sharp touch and soft touch. So kind of close your eyes, and you're going to let me know if you feel sharp or soft.
Sharp. Sharp. Soft. Soft. Sharp.
Beautiful. Okay, so your sensation is intact, and everything seems to be in very good order here. You seem to be in very good health, taking care of yourself. I can tell that for sure. It's great that you're coming in every year to get your physical. I hope you continue to do that. Do you have any concerns about anything?
You covered all the systems that I didn't know I had.
Okay. All right. So always feel free to come in if you ever have any issues or concern with anything. And it was great meeting you.
You
Thank